Hello, I'm Jill Webb from Jill Webb Training, and I'm really pleased today to present this short video to make sure you're completely up to date with some changes to first aid protocols that came into force in 2025 and they're beginning to be embedded in teaching this year 2026. So we're going to look today at a casualty who is unconscious but breathing. But for any casualty, if someone seems to need medical help, we need to do three things beginning with C. The first thing we need to do is check for any danger to ourselves, bystanders and the casualty. So is the traffic, are there live wires, is there something you might slip or trip on? The second C is call, and if you've been on a first aid course in the last few years, this has now changed. We call 999 as soon as we realise a casualty is not responsive. We don't wait to check the breathing. And the third C is CPR. If needed, we start CPR. We're not going to do that in this scenario. You will see that in a later scenario, but that's how the three C's work. Now what we're going to work through now is a protocol which is recommended more and more by the European Resuscitation Council, that we learn systematic ways to do first aid. It's going to come up on the screen now, so you might even want to take a photo of it or screenshot it so you've got it to hand as we go through the next stages. And you will see that it starts with D for danger. So as we've already said, as I approach my casualty, I'm just going to check for danger. Is there any reason that I can't touch my casualty? He's not being electrocuted or anything. Is there anything that could cause more danger to the casualty or myself? I'm then going to see how responsive the casualty is. Danny, can you hear me? Come on, if you can hear me, open your eyes. So I'm going to shout at him. I'm not being polite now. I want a response. Did you notice I clapped to make a bit more noise, might make him jump, and a bit of a shake of the shoulders? If there is no response, then what I am going to do, remember, is phone 999. Hopefully I won't be alone, so I can say to somebody else, can you go and phone the ambulance, bring the phone back so that you can talk to the ambulance dispatcher. If you are alone, please learn how to have your mobile phone on loudspeaker. It'll make this bit so much easier. You can have it on loudspeaker while you're doing this. So we've checked for responsiveness. We're now going on to the small c, which is new in this protocol. And that small c is catastrophic bleeding. We now realise that catastrophic bleeding can kill people before not breathing does. Now you don't need to look for a catastrophic bleed. It'll be there. It's usually the loss of a limb, something like that, a really major wound. It will be spurting. And what you need to do is put direct pressure on it as quickly and as sort of hard as you can. Again, hopefully there's more than one person who can help each other. Many first aid kits are moving to have tourniquets in them, and you'll certainly be taught in your next course how you can make a tourniquet, but only for using on a catastrophic bleed. So we're now going to go on to A, which is airway. So what I'm going to do is a head tilt chin lift. I'm going to take my palm of my hand and I'm going to tip Danny's head right back, and I'm going to make that motion with my fingers. You see a thumb and two fingers, and I'm going to do a chin lift. Now what you will see on the screen will demonstrate why this is important, because we're really opening up the airway so that if the tongue is blocking the airway, hopefully it will move out of the way. And once we've done that, we're moving on to breathing, and we're looking, we're listening, and we're feeling for 10 seconds. Looking down the chest for movement, listening for breaths, and feeling on our cheek, especially if we're outside. We're wanting to see or hear or feel 2 or 3 good quality breaths in that time. And if we don't, we will go on to CPR. But if we do, we're going to now do a circulation check. So for a circulation check, I'm going to basically check there's no bleeding anywhere that I haven't noticed. We will notice most bleeds, but for instance, is Danny bleeding behind the back of his head? I might not have noticed if he's fallen backwards. Is he bleeding under his torso? Is there any blood in his boots if he's got big work boots on? And we're also going to look for internal bleeding. Internal bleeding makes the skin very rigid and appear bruised. The easiest way to check if nothing is obvious is think about Danny's tummy as a hot cross bun, the cross being on his tummy button, and just gently palpate each of those 4 areas. Even someone that's quite fit, if they're well, will have quite a squidgy tummy. So, we've done danger, we've checked for responsiveness, and we've called 999 if there's no responsiveness. Small c, catastrophic bleeding, airway, breathing, circulation. We're now coming to the new D in the process, which is for disability. Now, this is not about SEND. This is about the AVPU scale, and the AVPU scale will appear up on the screen. The AVPU scale is about the level of Danny's consciousness. Is he awake and alert, in which case he's in the green, or is he unresponsive, in which case he's in the red? And we're going to just check again. Danny, can you hear me? Come on, if you can hear me, open your eyes, a bit of stimulus, shaking of the shoulders, something like that. And then E. Again, if you've been used to doing this on a first aid course in the past, E is now a little bit new and different, and that's about exposure. Now, please, we're not going to take all Danny's clothes off in public, but what we are going to do is just check, is there anything obvious, like underneath his t-shirt, are there any burns, is there any swelling? Anything that sort of immediately might need treating and might help us to know what's happened. If Danny continues to be unconscious and does not have any injuries, the safest position for him to be is on his side. There may be times when you find an injury, in which case, if the breathing is stable, just leave the casualty as they are and seek advice from the ambulance service. So what we're going to do is roll Danny over into what's called the recovery or safe airway position. There's lots of ways you can do this. I'm going to show you one. So I'm going to take Danny's arm nearest me and lift it out of the way. I'm then going to take Danny's arm that's opposite me on the other side of his body. I'm going to hook it up, and if I've got it right, you'll see my fingers wiggle. If Danny's fingers were wiggling, it'd be a butterfly. I'm then going to put the back of Danny's hand onto his cheek. I'm then going to bend up Danny's leg because that will help me to roll him over. It means that I can roll over, for example, quite a large man because I've got the power of the leg. And then I'm going to gently roll Danny towards me. I'm going to pull out that leg to support him, and I'm going to pull out that arm. Now, because Danny is not very flexible, you won't really be able to see how he should look. So as this demonstration ends, you will see up on your screen some examples of what the safe airway position should look like. So now the demonstration's over and you've had a look at the pictures on the screen, you might have noticed one of those pictures was a child. And actually, when we think about dealing with an unconscious child, the process is exactly the same. You will often find it easier to actually roll a child because they're smaller. And finally, I'm going to get my baby from over here and tell you about how we do this protocol with a baby. And again, the really good news is it's dead straightforward. We're going to use our Dr. C ABCDE protocol. Here's a couple of tips. When we want to check for a baby's responsiveness, let's clap, tickle their feet, and blow in their face. Clap, tickle, blow, a really good way to make sure if a baby's responsive because they'll usually react if they are. The other really good thing about a baby is it's very easy to put them into a safe airway position because basically you need their bottoms higher than their heads in case they're sick or choke. So dead easy, hold a baby something like this. The advantage of that, of course, is if I can hear help coming to the front door, I can take the baby with me. So we've covered a lot in this video. Let's just have a quick summary of what you need to do. The first thing you need to do is a quick assessment. Is there a risk of further harm? Is it safe for you to approach? Can you move the casualty to safety if there's fire or flood, for example? Once you're in a safe situation, responsiveness, can the casualty speak to you? Are you okay? Gentle stimulation, shaking the shoulders, clapping at them, whatever. If they're responsive, which is good news, stay calm and ask their permission to help them, and then see where things go from there. If they're not responsive, which we've been looking at this video, we check for a life-threatening bleed. If yes, we apply direct pressure. Do you remember I called that a catastrophic bleed? If there is normal breathing and no other trauma visible, we move the casualty onto their side with their arms and legs bent and their head positioned to ease breathing, which is the safe airway position which I showed you earlier. I hope that's a useful summary. Thank you for your interest and I hope you found this useful.